Hello, good evening. I am Dr. Soumyadip, MBBS, MD Medicine. I am a consultant physician and diabetologist practicing in Malda. I am attached to Malda Medical College and Hospital. Today, we will talk about hypertension, or otherwise what common people say high blood pressure. We will talk and see what happens if a person has high blood pressure. So basically, to start with, what is hypertension or what is high blood pressure? The thing is, in normal individual, when the heart pumps the blood into the blood vessels, it creates a pressure against the blood vessel wall, which is called blood pressure. Normally, it is about 120 over 80 millimeter of Hg. That is, 120 is systolic blood pressure and 80 is diastolic blood pressure. But in certain circumstances, this reading can go up to 160 or 170, and the below diastolic reading also can go up to 90, 100, which is when we call it as hypertension or high blood pressure. But in otherwise, in normal individual also, throughout the day, blood pressure varies. Blood pressure rises and falls also. So there is a continuous variation in whole day in normal individual. So that also should be kept in mind. So what happens if a person has high blood pressure? It creates some minimal symptoms. That is why it is called silent killer. But in certain circumstances, it can create a very serious problem, right? Heart failure, cerebrovascular attacks or strokes, or even sudden cardiac death. So minimal symptoms to start with: when a person feels morning headaches, dizziness, fatigue, nausea, vomiting, or some buzzing in the ear, some visionary problems, then the person should go to a healthcare facilities, to a doctor or to a nurse or to any other healthcare facility to check his blood pressure. Normally, the blood pressure can be easily diagnosed. It is the most easily diagnostic tool, which is measured by sphygmomanometer, which is present in each and every chamber, each and every doctor's chamber. One can easily measure his blood pressure. But when a person visits a doctor's chamber, his blood pressure may go up, which is called white coat hypertension. But when a person stays in calm and quiet surroundings, like in his own house or in his own room or in his bedroom, when the person is relaxing, the blood pressure may be below the higher point or below what is found in doctor's chamber. So we should keep in mind that we should monitor throughout the reading, throughout the day. Now, what are the risk factors? What are the causes or risk factors which can cause high blood pressure? There are few risk factors which we cannot manipulate, like age. Number one is age. When the age increases, normally what happens is the blood pressure rises. The reason behind is the arteries, the blood arteries, blood vessels, the arteries get stiffen up and fat accumulates. So automatically it creates a sudden rise in pressure, which is seen in high blood pressure. Age, which is not, we cannot manipulate this factor. Another factor is hereditary or genetic. If the person's family member, some grandparents or some mother, brother, sister, anyone has high blood pressure or the history of heart diseases, then he should check his blood pressure very frequently. Next, few modifiable risk factors are unhealthy lifestyles, unhealthy food consumptions, dietary. Next is physical less activity, less physical activity. And next is obesity, which is not manipulative. Now, if a person has blood pressure, what should he do? First of all, a doctor tries to control his blood pressure without giving medications, like some modification of his lifestyle and some dietary habits. What are the things? The number one is regular physical activity. A person who is diagnosed with hypertension should actually do at least 30 minutes of moderate physical activity on most days of week, like jogging, brisk walking or swimming, any other aerobic physical activity, at least at 30 minutes on most of the days in a week, which is very essential and very helpful in controlling blood pressure. Next is diet. The person who is hypertensive should control his dietary salt intake. At least he or she can follow DASH diet. DASH stands for Dietary Approach to Stop Hypertension. So what should we do? He should take less sodium in the sense like he should avoid processed food, like processed food has more sodium than natural food. When in table, like in dinner table or during lunch or during dinner, he should not consume any extra amount of salt. He can add other spices or herbs to add flavor to his food, but he should avoid extra salt. So after physical activity and dietary approach, next is to keep stress free. Stress is an important factor which can cause high blood pressure. So what can a person can do to relieve his stress? He should do regular yoga or meditate, or to a certain situation which can arise stress, he should avoid these situations. Next thing is he should take regular medication. If the doctor advises any medications to stop hypertension or to control hypertension, he should take these medications regularly. If he doesn't take, the blood pressure shoots up. Next, after regular exercises and healthy lifestyles and dietary control and stress free and regular medications, one should regular monitor the blood pressure in doctor's chamber. Not that a person has blood pressure and which is diagnosed like a certain time, and after that the person goes to a second visit after 1 year or 2 years. That is not the case. He should go every 3 months or every 6 months at least to check his blood pressure. So to summarize, the blood pressure is nothing but the blood causing pressure against the walls of the blood vessel, which is called as blood pressure. So there are certain risk factors which I already said. It can cause high blood pressure, and there are certain ways we can prevent it also. Thank you.